Reach Out, in my eyes, is a totally community-based program in every sense of the word. We are living within our community. Our patients are, or clients, as I like to think of them, are all from here. And so we know each other and we help each other, not only with the medical issues, but when you work with poor people, you really have to look at the whole part of the family as well, of the food and how they can participate in the community.
Reach Out is a faith-based organization, and it started in this place of Mbuya. It started in this church way back in the year 2000. The situation of HIV/AIDS in the whole country was very, very bad. And of course, people, because they believe in God, people were coming to church to ask God to help them. So the Christians here, inspired by their faith, in the year 2000, 2001, they started to do something. They came together. They were led by the parish priest in this place by then, the late Father Joseph Arketi, also a Comboni missionary, and also Dr. McGriff from Denmark, who joined him, and they led these Christians to start to do something.
I came to Uganda in January 2001. I first time met Father Joseph Arketi, the parish priest of Mbuya Parish. He said, "I want to meet you, doctor, because I'm giving the last sacraments to people in the community, and 2 months later they are up singing in the choir. What is happening?" And what was really happening was that because of people were not dying of their HIV/AIDS per se, but the opportunistic infections, which we could treat. And Father did then the beautiful thing that he invited us to come and make a clinic in the church. And that was just in the bottom under the church, the proper church, a couple of rooms, and we could start clinic from there. And what we did with the volunteers, we basically just trained them in all the parts of the work that could be done and what they would be best at by apprentice training. The program grew really, really fast. Finally, PEPFAR came in and we had an opportunity to be part of the ARVs came. It was a miracle for all of us. And we were so ready, because we had already about 110 patients that we had on the ARVs from individual fundraising. And on the 15th of March 2004, we had the first patient get the drugs from PEPFAR. I didn't know it at the time, but we were actually the first ones in the world. But it is the most wonderful thing that has happened here, because these were all people who were parents, brothers, children of their parents who got in and who are living now, and their children have been able to grow up without AIDS and with a parent. But with the ARVs coming in, everything changed, because then people who were dying stepped out of the grave and are now moving forward, living their lives.
Reach Out has a niche in this society, and it has been targeting the poorest of the poor and going out to them. The community approach that Reach Out has been a unique approach. Not only do they find the clients in their homes, but they follow up and link up. There's a linkage between the community and the facilities. We have 3 facilities in Kampala, here at Mbuya, one at Kinawataka, and the other one at Banda. The community department is very important in Richard's program because we work with the community and we support each other. Reach Out provides treatment, yes, but we know that the environment around the individual affects the uptake of the drugs. So we go out to the community to ensure that the clients are supported. We have village meetings where we hold dialogue meetings with community members to find out what are the challenges they are facing and what are the new issues that are cropping up that we need to address. So the community aspect ensures that the client receives holistic service.
PMTCT, it's prevention of mother-to-child transmission. This is a program that started in Reach Out in 2004 to date. Right now in Uganda, we are at the elimination, so it's now elimination of mother-to-child transmission. As Reach Out Mbuya, we have managed to achieve zero transmission of HIV from our mothers to their babies. In each of our clinics, and also in the outreaches that our staff do, we have what we call mother-baby care points. These mother-baby care points have well-trained midwives, staffs that are dedicated to seeing them. We're able to provide antenatal and postnatal care, nutritional assessments for our babies and the mothers, young feeding infant options for both our mothers and babies, TB screening. We provide ARVs and also provide viral load monitoring for our mothers who are in care. We also have a community part, which has been a very key component of our PMTCT program. We have mother to mothers. These are mothers who came into the program, had their children, and successfully transitioned out of the program into the ART clinics with HIV negative babies.
To produce a negative baby, when I'm pregnant, they told me to attend the clinic every time, or when I feel I'm not okay, I have to attend the clinic. So, and my drug, I have to take them carefully. I should not mix. I should take them properly and at the very time I supposed to take. And when it comes to time for delivery, I should not deliver at home. I should go to the hospital. So I have 2 children in the Rich Hope. They are very okay. They have tested. The first one is very okay. Even this one, I believe by the time they are going to discharge him, will find is negative.
The Orphans and Vulnerable Children's Program at Reach Outside in 2002 with 23 children, and to date we have supported 12,000 children in the areas of health, education, economic strengthening, legal and child protection, psychosocial support, and nutrition support. And in this case, we are able to identify their needs through conducting household assessments. And in supporting them, we use the family-based approach, where we not only support the child, but also include the family for sustainability purposes. Through education support and through the support of the generous donors, both local and international, we've been able to support these children at primary, secondary, even up to university level.
I joined Reach Out in about around 2009. That's when I was discovered that I had the virus. So they came in with my mom, because my mom had TB by that time. So when she was tested, she got the counseling and they told her, you bring your son too so that we test. That's how I got the opportunity to get a second chance in life. So they took my hand and started sponsoring me around 2009. Up to right now when I'm in my final year, finalist at YMCA, where I'm pursuing guidance and counseling, and maybe hopefully next year around March I'll be graduating.
So we started the peer groups because we knew that these young peers who are HIV positive are going through a lot of challenges. If the problem is about stigma and discrimination, because I know all of us have gone through that, and in most cases I usually use my own personal experiences. In doing that, I know it is helping someone else, because I know someone else is going through something I went through, and I want these young children to also accept what they are. Accept what you are, disclose to the nearest people around you, life will be more easier for you, trust me.
HIV should not hinder any child whatsoever out there from living to their full potential. And we at Reach Out always ensure that we serve the most neediest of these children.
I'm the supervisor for Roses of Mbuya, an income generating and skills empowerment project to the youth and the OVC. These are the orphans and the vulnerable children that Reach Out serves. We offer trainings for the OVCs, that is in tailoring, shoemaking, catering, weaving, knitting, and also we raise income to support these OVCs at school through the tailoring workshop that we manage.
The grandmother's project started in 2014, which was July. We had a target of 100 grandmothers. Those who are HIV positive and those who are caretakers of people living with HIV. But as we reached in the community, we found out that there are so many grandmothers who wanted this kind of help. So in 2014 to 2015, we reached 832 grandmothers. Those who are very vulnerable, they do not have where to sleep. So in doing such, we provided them mattresses, blankets, and bed sheets.
Ndi wamu ne mama wange naye embeera gye twalimu kale yali tesanyusa bulungi. Abasawo bajja awaka ne balabirira mama wange, baamuleetera omufaliso, n'afuna bulangiti, nange kennyini nafuna bulangiti n'enfuna omufaliso. Funa obulabirizi bw'amaanyi nnyo, obuyambi bw'enfuna bw'amaanyi nnyo awaka. Akawunga bampa, obujanjalo baleeta buli mwezi nfuna ekyokulya. So nga ate nze sikyasobola kulima bulungi naye nze ndi bulungi. Nange kennyini wano nzija n'enfuna eddagala, so nga ate luli tekyaliwo namalanga kutambula ogenda okufuna eddagala. Nina omwana omuzzukulu baamusomesa P7 n'agimalanga sitoddeeyo wadde olwataano. Era nze neeyanze ebyo byonna bannange bye mutukolera naddala mu maka ewange.
Again, since we found them they are in a poor state, we introduced what we call VSLA, Village Savings and Loans Association.
How does this Village Saving and Loan Association work? It is a self-select model because we need at the end of the day to be knowing each other. A minimum of 15, a maximum of 30 members per each group. And we have over 400 groups ever since the program started, which would be summing to over 12,000 members. The basic or the most important objective was to instill the saving culture among our clients and see that they can also be empowered to do something.
In the beginning, we used to save as individuals in our houses, but Reach Out came up with a saving group that they also took us for more skills. So we gained more skills of how we could save. So with the BIDS project, as you can see, the women are specializing in the different stages they can do best in. And when we get orders of market, that's how we come up together as women, widows. We do something that we have been ordered to do. And these different products that you see are made of papers. But when we come together, we specialize so fast, and the orders are made up very fast, and they are taken. So from these products is where we get the money that we save. So when we come together, we open up the box, and we share the money amongst ourselves. We also have gone to the extent of opening up account for our saving group. All this has been done because we have got future plans as widows.
We have made sure that we formed family support groups. Now, Ministry of Health came up with these family support groups to act as psychosocial support for the family. And these have helped especially in male engagement, which is also a very key component of our program.
It's a global problem, it's a national problem that men are not getting involved in HIV prevention programs, health programs, and also supporting their wives and gender-based, stopping the gender-based issues. Now what Reach Out has done is we came up with strategies of reaching out to men than waiting for them to come to our clinics. And one of them that we have done is starting up Operation Gideon program. It's a program for men, reaching out to men, not men reaching out to our clinics, not men reaching out to us. For us, we reach out to men and we go to places where they drink from, to places where they can spend time and play football and watch football. That's where we go. And we have seen that these strategies have got yields.
And I would say Reach Out is a total mosaic of everybody getting together. We are going together. Each piece is nothing but together we are actually a very beautiful picture.
Ashimele,